Gody Mom, I'm Cherilyn Vitter. Today, I'm gonna discuss the natural and artificial method of contraceptives. First, oral contraceptive, often referred to as the birth control pill or colloquially as the pill, is a type of birth control that designed to be taken orally by women. The advantage of using contraceptive pills, the birth control pills, is a safe, simple, and convenient way to prevent pregnancy. It has also other benefits like reducing acne, making period lighter and more regular, and easing menstrual cramps. The disadvantage of using contraceptive pills, it can increase your blood pressure. It does not protect you against sexually transmitted infection. Breakdown through bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of someone's serious health in conditions such as blood clots and breast cancer. Transdermal patch. Transdermal patch adhere to the skin as a way to deliver drugs. They provide a specific, predetermined dose of medication that is absorbed through the skin and into the bloodstream. Therefore, transdermal patches offer a non-invasive and painless method of drugs delivery, with the added benefit of providing a consistent therapeutic dosage over a predetermined time period. Vaginal ring. It is a polymeric drug delivery device designed to provide controlled release of drugs for intravaginal administration over extended period of time. The ring is inserted into the vagina and provides contraception protection. Vaginal rings come in one size that fits most women. The advantage of vaginal ring is used correctly. The vaginal ring is more than 99% effective. One ring provides contraception for a month. The disadvantage of vaginal ring, you can have spotting and bleeding in the first few months. It may cause temporary side effects such as increasing vaginal discharge, headaches, and mood change. Subdermal implant. A subdermal implant refers to a body modification that is placed underneath the skin, therefore allowing the body to heal over the implant and creating a raised design. Such implants fall under the broad category of body modification. Many subdermal implants are made out of silicone, either carved or mold injected. The advantage of subdermal implants include long-term contraceptive action without requiring the users of providers' attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. The disadvantage of subdermal implants is your period may be irregular or stop altogether. You may get acne or your acne might get worse. Hormonal injection. The contraceptive injection prevents pregnancy by injecting a synthetic version of the hormone progestogen called dipomedroxyprogesterone acetate or DMPA. Depo prevents the body from producing its own hormones and releasing eggs from the ovaries. The side effect of hormonal injection, it includes weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your period may become more irregular, heavier, shorter, lighter, or stop altogether. Intrauterine injection. A type of artificial insemination is a procedure for treating infertility. Sperm that have been washed and contracted are placed directly in your uterus around time your ovary release one or more eggs to be fertilized. The advantage and disadvantage of intrauterine injection, it is less invasive, it is less expensive when compared with less stress on the body. Washing procedure enhance sperm quality. This process will remove prostaglandins, infections, agent, immature germs, cell, and etc. as it results in quality sperms. Chemical barrier. Chemical barrier destroyed pathogens on the outer body surface at body opening and on inner body linings. Sweat, mucus, thirst, and saliva all contains enzymes that kill pathogens. Urine is too acidic for many pathogens, and semen contains zinc which most pathogens cannot tolerate. The disadvantage of chemical barrier methods of birth control: these methods do not prevent pregnancy as well as hormonal form of birth control. Barrier method prevent pregnancy only if you use them every time you have sex. The advantage of chemical barrier is barrier method costs less than hormonal type of birth control. Diaphragm. Diaphragm located below the lungs is the major muscle of respiration. It is a large, dome-shaped muscle that contracts rhythmically and continually, and most of the time involuntarily. Upon inhalation, the diaphragm contracts and flattens and the chest cavity enlarges. Most young women who use a diaphragm have no problem with it, but possible side effects include from the spermicide, irritation of the vagina and surrounding skin, or an allergic reaction. Cervical cup. Cervical cup is a form of barrier contraception. A cervical cup fits over the cervix and blocks sperm from entering the uterus through the external ovaries of the uterus. Most girls who use the cervical cup have no problem, but possible side effects may include from the spermicide and surrounding skin. Male condom. A male condom is a shot placed over the erect penis before penetration, preventing pregnancy by blocking the passage of sperm. It is a barrier of contraceptives. The disadvantage of male condoms is reduced sensitivity during intercourse is a commonly voiced concern with couples. The advantage of male condom reduces the risk of spreading sexually transmitted infection, including the human immunodeficiency virus. Female condoms. Female condoms are a barrier method of contraception worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. A female condom can be put into a vagina before sex. Female condoms do not have any side effects except to individuals who are allergic to latex. Surgical methods. It refers to all invasive therapies performed as inpatient surgery, where inpatient surgery is defined as a surgical operation or procedure which is performed with an overnight stay in a patient institution. Side effects of surgical method are sore throat, soreness, pain, and swelling around the incision site. Natural methods. First, abstinence. Abstinence is self-enforced restraint from indulging in bodily activities that are widely experienced as giving pleasure. Most frequently, the term refers to a sexual abstinence, but it can also mean abstinence from alcohol, drugs, food, and etc. When sexual abstinence is involuntarily, some individuals may feel negative effect on their mental health. Conversely, people who do not feel sexual desire may find this feeling distressing. Calendar method. Calendar method are various methods of estimating a woman's likelihood or fertility based on a record of the length of previous menstrual cycles. Various methods are known as the Naus-Oheno method and the Rime method. Basal body temperature. Basal body temperature is the lowest body temperature attained during rest. It is usually estimated by a temperature measurement immediately after awakening and before any physical activity has been undertaken. Cervical mucus method. Fertility awareness refers to a set of practices used to determine the fertile and infertile phases of a woman's menstrual cycle. Fertility awareness method may be used to avoid pregnancy, to to achieve pregnancy or as a way to monitor gynecological health. Symptothermal method. It is a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and observes signs and symptoms of ovulation. Both these methods are associated with side effects, particularly in combination with other medication and tobacco, and health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, and blood clots. Ovulation detection. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in utilizing hormone in urine. A rise in this hormone signals the ovary to release the egg. Coitus interruptus, it also known as withdrawal, is a traditional family planning method. A contraceptive technique does not make use of artificial devices. However, it does have several disadvantages. Men discharge a small amount of semen before ejaculation. Side effects include loss of sexual. That could be all. Thank you.